name is Paul Mosqueda, and along with my teammates Zachary Keith, Tommy Hosfield, and Carson Raymer, we will be discussing capacity planning for COVID-19 diagnostic testing centers. Our sponsor for this project is Wichita State University. The university, established in 1895, is located in Wichita, Kansas, and is accredited by the HLC-NCA. Wichita State offers 60 undergraduate programs and 44 master's programs, with over 16,000 students enrolled. The interim president is Richard Muma. It is the responsibility of Sedgwick County to make COVID-19 testing available to all of its residents, while also officially allocating its resources. The county currently has two types of testing centers, stationary and mobile outreach response testing sites. It is the task of our team to identify, evaluate, and procure plans to optimally locate these testing facilities and properly staff them. We will accomplish this by utilizing methods of operations research, which will be used in optimizing existing testing facility locations, and we also use queuing theory, which will help aid us in staffing decisions. Our team will focus on optimizing existing Sedgwick County COVID-19 testing facilities. To accomplish this, we must consider the following factors: rates of demand and positive tests, distance, and population per zip code. Both stationary and mobile testing facilities will be standardized and then optimally staffed to help in streamlining the flow of patients while also minimizing wait times, excessive delays, and maximizing utilization. Our objectives for this project are to first, develop an operations research model to optimally locate facilities. This model will locate stationary facilities in an equitable fashion. It will also locate mobile testing sites with a focus on the vulnerable population, which include areas that contain larger number of minorities, areas with large number of nursing homes, and areas that contain large businesses. Our inputs for this model will be determined by analyzing current data. Our second objective is to apply queuing theory to identify appropriate staffing. This will help us determine staffing assignments for each station within a facility. It will also ensure that employees are properly utilized and wait times are not excessive. The design requirements for this project are as follows. Stationary testing facilities must be optimally located with the purpose of minimizing travel distance for residents of Sedgwick County to the facility. Mobile testing locations must favor vulnerable populations. We must limit the number of testing sites and make sure they are optimally staffed. Also, testing locations must be selected from a predetermined list of facilities.
Our team used the base facilities location operations research model to decide optimal locations. The thought behind this model was always to be more equitable to the people of Sedgwick County, ensuring the ease of access to testing. To accomplish this equitability, we modeled this problem around minimizing the distance the average citizen would have to travel in order to get tested. After creating the base model, it was important to add in additional relevant constraints, such as the limits to the number of testing facilities in Sedgwick County. We also needed to formulate a constraint for the number of staff to be allocated per testing facility. Another constraint to be formulated involved making sure every quadrant of Sedgwick County contained at least 2 testing facilities. Beyond just modeling, the team needed to find the necessary data to fuel into the model, something that is explained throughout the rest of this presentation.
Hello, my name is Tommy Hosfield, and as mentioned earlier, our team is using operations research techniques to find the optimal location of Sedgwick County COVID-19 testing facility sites. Within every single OR model, there are plenty of variables that go into it. Some of the variables that we have chosen are down below. The first one you'll see is DJ, which is the demand in zip code J. Then you'll see CIJ, which is the distance from the center of zip code J to location I. There's XIJ, which is the fraction of customers in zip code J that is served by location I. There's YI, which is the binary decision variables of potential locations I. K is the number of servers necessary for location I, or the amount of staff that will be allocated to a particular location. And then UI is the capacity of a given testing location I. All these variables are thrown into the model directly above. Starting with the objective function, we are attempting to minimize the amount of distance that a patient will have to travel within Sedgwick County to get tested. We're also trying to minimize the amount of staff that we have to allocate to each of the optimal testing facility locations. This objective function is inhibited by the following constraints, the first one being the sum of xij has to equal to 1. This is saying that everybody within Sedgwick County will have a particular location that they can be served at. The next constraint is a capacity constraint. It's basically saying that whatever amount of demand that is allocated to a particular site cannot exceed the actual capacity of that site. The next constraint is saying that the sum of all yik has to equal to p. This is basically saying if we want to find only 10 optimal locations, then the model will find 10. The next constraint is that yik belongs to either 0 or 1. 0 being that we do not choose the site as an optimal location, or 1 meaning that we do choose the site as an optimal location. Then last but not least, xij has to be greater than or equal to 0. In addition to the previous slide, we have more constraints that are based off of our queuing theory analysis. From our analysis, we were able to determine the maximum amount of demand that potential sites could take on depending on some factors. These factors were the staffing level, the service level, the maximum wait time, and the testing rate. Again, these factors were able to determine the maximum amount of demand that a particular site could take on. Now, these constraints, what they do is they make sure that whatever amount of demand that's allocated to a particular location, it ensures that that demand does not exceed the maximum amount of demand that site could take on. Then outside of queuing theory, there's also the quadrant constraint. The idea behind this constraint was to add more equitability into the model. And what it does is it splits up Sedgwick County into 4 different quadrants. It ensures that when the model goes to solve for optimal locations, there's at least 2 optimal locations within each quadrant that you see below in the picture. We made another OR model for our mobile sites. In this model, we are attempting to serve the more vulnerable areas of Sedgwick County, as determined by our variable down below, WJ. WJ is a summation of the percentage of non-white population within a zip code, plus the percentage of nursing homes in a zip code, plus the percentage of major employers in a zip code, plus the percentage of high schools within a zip code. This WJ value goes into the objective function at the very top, with higher values of WJ incentivizing the model to place an optimal location within or near that particular zip code. Of course, this objective function is subject to the following constraints. The sum of all xij equals 1, meaning that all demand is met. Xij is less than or equal to yi, meaning that demand will only be allocated to a location if that location is chosen as optimal. And that the sum of all yi is equal to p, meaning that if we only choose 10 sites to be optimal, the model will only find 10 sites for us. And then yi is binary, 0 or 1, 0 meaning that it's not optimal, 1 meaning that the location is optimal. And then xij is either 0 or 1, 0 meaning that no demand is administered, or 1 meaning that all demand is administered from a particular zip code to a particular location. As you can see, our models have a lot of variables. Some of these variables you have to know before you're solving because they are input variables. These data points were able to be gathered from 2 main sources, the Sedgwick County COVID-19 dashboard, as well as the MapQuest API. We were able to gather things like the population, the total tests administered, the total confirmed cases, and the testing rate per 10,000 per zip code from the Sedgwick County COVID-19 dashboard. In addition to that, we used the MapQuest API to find the distances from a zip code to a particular location. In total, we had about 5,500 of these distances to find, and doing so manually would have taken a long time. So instead, we created a Python script that would query one of the public MapQuest APIs, and that script is off to the right.
Depicted is a map of the current stationary locations employed by Sedgwick County. It is apparent that these current facility locations are not as equitable to all residents of Sedgwick County as they should be. For instance, some residents of western Sedgwick County will have to travel many miles in order to get tested at a time when a good majority of its residents are unable to. Depicted are the current locations of our mobile sites based off our OR model. Our mobile sites were employed based on a weighted sum of population of at-risk ethnic groups along with counts of nursing homes, assisted living homes, major employers, and high schools in each zip code, as each of these clusters tend to be hot zones where the virus is able to thrive. To adjust for the equitability of all residents of Sedgwick County, the OR model returned the following optimal stationary sites with the following staffing measures. As you can see, the general trend of more staff being assigned when demand was expected to be greater occurred, allowing for a greater throughput of individuals getting tested. And most critically, the locations are spread across Sedgwick County to allow for greater accessibility amongst all residents. Our major measure of achievement is comparing how the current status quo compares to our optimized stationary facility location in terms of distance having to be traveled by each resident of Sedgwick County. This was best showcased through the use of histograms, as it is apparent that the optimized stationary facilities serve the residents of Sedgwick County better. This can best be illustrated in the histogram shifting its data to the left. Additionally, along those same lines, our model now establishes that some residents of Sedgwick County can now travel 1 mile or less to get tested.
The rest of our presentation will focus on analyzing our stationary site model. Here you can see a list of inputs that have gone into our model. Now, it's important to note that from this list is largely made up of management decisions. How many sites should be operated in the county, how long they should operate for, the maximum wait time of a customer at one of those sites can all be adjusted. We hope to illustrate from this analysis that our model is not going to give you just one simple answer. Rather, it is a tool that can better inform the county decision makers, and it's not dependent on our data or our assumed inputs. As Tommy illustrated earlier, we divided Sedgwick County into 4 quadrants, and ensured that the model would put at least 2 sites in each quadrant. However, now that we've relaxed that constraint, we can see that our optimal locations have changed, and that more people, although not by much, are traveling less than 1 mile to their nearest testing center. As you probably guessed, the more testing centers that are operated, the more accessible they will be to the greater Sedgwick County community. Having 20 stationary sites has a major impact on the distance that many citizens would have to travel, as you can see in the graph here. Here we raise the service level. This means that previously a customer had a 5% likelihood of having to wait more than a specified amount of time. But now there is a 0.01% likelihood of their wait exceeding that time. Now, while this has no real impact on the geographic locations, it does increase the staffing from 26 to 38 staff members who will be required by the county. The same principle is shown here. However, we see that there is a much smaller cost to achieve a 95% service level by only increasing staffing by 1 person from the 70% level. In the last 2 slides, I alluded to the likelihood of a customer waiting over a set amount of time. Here we change that amount of time significantly, increasing it to 40 minutes. Here our customers will experience longer wait times, however it will require less staff. Here we apply the same principle as we did from the previous slide. However, in this case, we lower the time that a person can be expected to wait from 10 minutes to 3 minutes. As you can imagine, this takes a large toll on the amount of staff we have. We now have to increase our staffing from 26 to 39 staff members. Here you can see that when the demand is altered, the locations are altered as well. This is because our model takes into account each zip code's demand and adjusts accordingly, meaning that even if this tool was implemented in 3 months when demand has completely changed from what it is now, it will still be able to provide helpful information to our county's decision makers. In conclusion, our project has provided an excellent example of how we as industrial and systems engineers can help our community. It also shows that with the tools we have learned as IEs, they can be applied to much more than just a shop floor. Together, we have successfully created a tool to inform our county's decision makers by finding where stationary and mobile testing locations should be placed throughout our county and how many staff members should be placed at those locations. Now going forward, we would want to have more input from our county's health officials. This input would consist of ensuring our data we have given the model is good, because as we know, if we give a model garbage data, all we can expect in return is garbage. Additionally, we would desire the decision-making perspective of the county. We as engineering students in this case are simply analysts. We are not public health experts, nor are we epidemiologists. We would want to know if there's anything that we overlooked in creating our model so that we can better provide information to those in a place to make decisions that affect the health of our county.